Now, one thing that seems to be so different with this Omicron variant is our kids, right? The U.S. now averaging, 260 pediatric COVID hospitalizations a day. Obviously, a big jump from the numbers that we were seeing. What do we attribute to this?
I think there's a few reasons. I think, first of all, the seasons have changed. The kids are all in school, and more importantly, they're eating lunch together. They're doing after school activities together, and they're hanging out. They're not transmitting COVID when they're in class, sitting at their desk with their masks on. The transmissions are always occurring when they're unmasked and sitting close to each other for more than that 15-minute interval that we've talked about many times in the past. That's how they're passing infection. It's interesting that people have talked in the past, oh, children aren't going to get COVID, they're not going to be so sick. Clearly, that's not true. Why is that important for us? Because it tells us that we absolutely must vaccinate our kids. When I think about who's in the hospital now, and you look at their vaccine rates, both children and adults, the ones that are not vaccinated, kids are not vaccinated, or the adults, those are our sickest patients. Those are the ones in the ICUs. The other patients that are coming into the emergency room, kids and adults that have been vaccinated, invariably, they're well enough to go home.